started having difficulty breathing. And I noticed that especially on my bike. Riding my bike is one of my joyous activities in life. It just feels good. My name is Jeff, and I live in Green Bay, Wisconsin. I was diagnosed about 3 years ago with stage 4 lung cancer. One obvious question is, how long do I have? And they gave me the answer in months. I was expecting at least years. I started looking at clinical trials, first of all, because the standard treatments weren't working. And second of all, I was very interested in maintaining a decent quality of life. And one of them that came up, the most promising one, was this thing that they're doing here in Cincinnati. They're doing it in other locations as well. It's a one-time treatment. And that, to me, that was super attractive.
I think the promise of this type of treatment, this TIL therapy, is the durability of the response. So TIL therapy, or tumor-infiltrating lymphocytes, is a new type of cell therapy where they harvest the patient's tumor and extract the immune cells from the cancer. And they grow those cells up in the laboratory, and then they're given back to the patient. The goal here is to have immune cells that are activated in multiple different ways to attack the cancer.
I come back here every certain amount of time to get a couple of scans. They're monitoring my situation. They want to see what's going on and how the treatment is doing. I think a lot of people are alive today because of clinical trials. This clinical trial just gave me a pretty good shot at maintaining a decent standard of quality of life. And to me, that was really the important thing.
I really prioritize patients' quality of life and that they're out there living their life. Patients like Jeff are enjoying a one-time treatment that has lasted for a long time, almost a year in his case. And I think that's because it's coming from his own body. I feel like patients that participate on a clinical trial get the best medical care because you are really being followed so closely, and I just think it really results in the best outcomes for patients.